Okay, good morning. Welcome to our listeners and Dr. Kavita. Thank you so much for joining us for part two of the lactation and breastfeeding conversation. Iman will be joining us shortly. Until then, we're going to try our best to answer some of the questions that have been sent to us and you guys have been bugging us about. So, Dr. Kavita, without further ado, is it further ado? Further ado?
Yeah.
Further
I
ado.
think so.
Yeah.
Yeah.
Okay. Um, I guess you can give a little spiel of if people don't remember who you are, but Dr. Kavita, who is specializing in breastfeeding and lactation. Take it away. Yeah, give a little intro about yourself.
So I'm Dr. Kavita. I'm a breastfeeding medicine specialist, perinatal GP, and IBCLC. And we're looking to try and establish breastfeeding medicine in Australia as a field, and we're making inroads with that, which is really exciting. Yeah, we still need to do a lot of work and changing the myths and all of that's really important. So thanks for having me. I love chatting with you guys. So
Thanks for volunteering your time with us.
yeah,
You're a
no,
busy
no.
bee,
Yeah,
that's
you
for
too.
sure.
All
Getting
of
in
us are,
contact
aren't
with you
we?
is hard.
Yeah.
Uh,
Okay, let's get going. Go on, give me the questions.
Okay, so one of our viewers, no, I shouldn't say one, some of our viewers want to know what are some of the implications regarding medication and breastfeeding? How much is getting through the milk? How much is going to impact baby, specifically antibiotics, for example?
Okay, so it's a big question, and I'll try not to go on too many tangents. Okay, the first thing that we need to know is the way we assess if a medication is safe in breastfeeding, something called the relative infant dose. And it depends on a few different things. It depends on how the molecule gets broken down, how it is bound to it, what it's bound to in the blood to see whether or not it crosses into the lactocyte, which is that milk making cell.
Mm.
And so if you want to know the safety of any medication, you want to know what the relative infant dose is. If it's less than 10%, it's pretty safe, and it means not much gets in there. The best thing to do would be to check with your doctors and get them to look that up. And I would even have to look up lots of medications, so don't expect them to know that off the top of their head. Obviously, the common ones, yeah, I'm well aware of, but something that's a little bit different, definitely. And you should want them to check it out because what if we get new information on there? There's a few
Mm.
sites as well where you can check this Hales medications, and there's also somebody in there's LactMed as well, which is amazing. But there's also a pharmacist in Victoria who's well known and whose name is escaping me. Hopefully, we can put it down here and later in the screen later. But yeah, that's another really good contact. Okay, but let me not get distracted. So antibiotics. Okay, what people are worried about the microbiome, right? The first thing is, if you need antibiotics, it is so much more important that you take the antibiotics because anyway, if you have a bug, your microbiome's affected. Okay, so we don't want to give antibiotics to people who don't need them. Okay, so that's the first thing, that your health is most important in this scenario. So make sure if you need them that you take them, but also ask all these questions. The second thing is, does your microbiome get disrupted?
Mm.
Quick answer is yes, it does. But you're obviously unwell anyway, so that's already disrupting your microbiome. But the real question is this microbiome disruption permanent and is it problematic? And the
Yes.
current research says that your microbiome will actually return to normal within 2 to 4 weeks with most of them. And when we say it gets disrupted, there are thousands, probably, I don't know, I'm probably getting it wrong, probably like millions of species in the gut.
Yeah.
And we could see an overproduction of a certain species
Mm.
over this, but we're not talking it's not significant in the sense that it should have a long-term impact on your health. And the good news, then, I'm trying to stick to time because last time I got so distracted, right? Is for baby. How does it affect baby?
Yes. Yep.
So little of the antibiotic actually gets into the baby's milk. So if we talk about the common ones like amoxicillin or cefalexin,
Yep.
right? We know they've got really good safety data profiles. And we also know that I can't, off the top of my head, remember what their RID is, the relative infant dose is, but it's minimal. So we don't need to pump and dump. You can continue to feed as normal. But also what I want you to know is that you don't need to think about, paying for expensive, what are they called? Probiotics or anything like that, because if you are breastfeeding, you are making the best probiotics in your breast milk. The third most dominant feature of breast milk is something called HMOs, the human milk oligosaccharides,
Yes. Yep.
which are sugars that feed the microbiome, which you know all about.
Absolutely.
So the summary answer to this is uh, you probably need the antibiotics if they want you to take it. And that's the most important thing. Yes, they might disrupt your microbiome, but being sick is also going to do that. And will it go into the milk? The small amounts may get into the milk. Will that disrupt that baby's microbiome? We need more data on that. But even if it does, the best thing to combat all of that is your breast milk. If you are formula feeding, we can also give you other types of strains, and you can speak to somebody who's well established in this kind of field and get the right kind of strains. But just buying a generic probiotic, I hate to see people wasting money, and it's got to be a specific one because all of this, yeah, they're just making billions of dollars off our insecurity at the moment. So yeah.
Yeah. Probiotics are very expensive.
They're so expensive. I
Yeah.
was like so shocked at how expensive they were because when one of my were little, my husband was like, "Let's just try this," and then I convinced myself it was working. Now when I think
Yeah.
back, yeah. Anyway, yeah. Okay.
Yeah. Well,
Next question.
yeah.
Let's go.
So we do know now that, everything when it comes to illnesses, that has to be strain specific. So
Yeah.
I think Iman is here.
Good. I don't know. Should I
It's
not be
good. It's fantastic. I just woke up today and I chose I just
professional?
wanted to be a bit extra. I was like, I'm putting on a blazer today for no reason at all.
Joining Iman is now back in the studio joining us because I said that you were going to be late.
Oh, this is still recording.
Yeah, still
Lovely.
recording.
Amazing. Yes.
Yeah, I'll put that in. So Iman has graced us with her presence today.
Yes, I have. Yes, late, but still
So
still relevant.
we are we've just covered question 1. We're getting through question 2, trying to answer all all the viewers, all the listeners, all their questions that are coming through. So one of the other ones that came up, Iman, was that what are some safe medications that you can take while you're breastfeeding? Do you have any advice around that? Do you know any particular ones, especially when it comes to common colds and flus?
Colds and flu was a big one.
Let us know your thoughts on that.
Yeah.
Look, most things, again, we have to be really careful when we use terms like most things, right? But most things can be taken, general things can be taken with breastfeeding. It's the problem is there's just a lack of knowledge out there, and there's just such fear about it, and we're not trained in it at all. So a lot of us will just be like, oh yeah, you better not take anything. So if we're talking about your typical viral illness, you've just got, headache, sore throat, runny nose, you're feeling, rough. What can you take? Panadol, paracetamol, completely safe. Ibuprofen, completely safe, not in pregnancy. If you're pregnant, don't take it. But you can take both of those. Pseudoephedrine or anything, Sudafed is the brand name that everyone knows, that can reduce your milk supply. So if we are trying to actually get people to, they want to wean and they want their milk supply to drop, that's something that we do use. It can drop your milk supply by 25% in some people. So I would be careful of that one. But in general, those kind of over-the-counter things are pretty safe. And it's really important if you're caring for a child that you actually look after yourself. And if you need symptom control, take it. But also don't discount things like, having a healthy, juice or tea. Because I actually had a patient who this week who was like, oh, can I have hot tea? Will that affect my milk? And we really should explain that I don't know if we did this last time, but when you take anything in by the mouth, it goes through a couple of passes before it even gets to your bloodstream. And then it has to go all the way back up to your bloodstream, back to your breast, and then across into the lactocyte to even get excreted into the milk. So a lot of things are a lot safer than we realize. I wouldn't be able to say these are the top 5 safe medications because, again, it just depends on your condition. But I have patients with complex medical issues on certain medications who are safely breastfeeding. And again, that goes back to what we were talking about in the first question, which is the relative infant dose and those kind of things. So, yeah.
And I guess that would sort of be similar with caffeine. I know that it's not a question here, but I know it's
caffeine. Yes.
Let me
bust this myth. Yes, let me bust this myth for you.
That was the biggest thing that I experienced when I gave birth because
Copy.
Liliana's almost 15 months. And, obviously being a new mum, you literally need the caffeine to survive some days. It's the only joy that you get in your day.
That's literally the only joy.
Let me just quickly double check. I think it's like 1.5. Let me just double check the relative infant dose. I'll pull up the LactMed. LactMed.
I read on the Australian Breastfeeding Association early on when I was doing all my searching because I was so worried about it, that only 1% of your caffeine intake passes into breast milk. And I was like, well, if I'm having 2000% caffeine during the day, which I very much was, I was like, that's not very much in the scheme of things. But then you'd hear people say things like, oh, you know, like, you know, when I have coffee or I have energy drinks or whatnot, you know, my baby would be up all night. Like I used to hear things like that.
Yeah.
And then I used to think, well, maybe your baby's up all night because they're cluster feeding babes.
Yeah.
But I'd love to hear your
I was
perspective
gonna
on that.
say, yeah,
Yeah.
Let me just get the exact number. I thought it was
some
1.5.
reasons.
Yeah,
Mm,
yeah, exactly. Yeah. So according to LactMed, it is 1.5% of the maternal weight adjusted dose. So, and that goes back to what we were saying. Let me find, where's that window gone again? Yeah. So 1.5% is what the RAD is of caffeine. That means almost nothing gets through, or if it does, it's a few drops. Absolutely have that coffee. Essentially,
You're like,
like yeah. Like, yeah, and you need to have those things. And it's also, don't forget, like, it's in chocolate, it's in tea. So it's coffee has gotten a bit demonized for some reason. And if you don't want to have coffee, don't have it. But again, if you enjoy it, you know, for me, that was my highlight of the morning, going and getting that coffee. And also just remember that the types of coffee you get are different. So if you get like an espresso and you drink four of those, it's very different to having two coffees throughout the day.
yeah.
And I was unfortunately an espresso person, and I was, yeah, no, had too many, but it didn't affect my kids' health, sleep, because she was already a crap sleeper.
yeah,
I
yeah,
shouldn't say that, but anyway, yeah.
Yeah, yeah.
So it was, yeah, a lot of that. If you notice that you're sensitive to it, some people are sensitive to it. So before I was like
yeah.
30, if I had coffee, I would get like palpitations and jitters, and then after that, suddenly I could just handle a lot more. So pay
Mm,
attention to your body, but it's totally safe. Please have the coffee. Please have the tea. Please have what you want to eat,
yeah.
drink.
Can I ask,
Mm.
this may, you can cut this out
Yeah,
if it
yeah.
was already covered, but you know, just the whole process of things we ingest as far as food and drink passing into the breast milk. It's obviously not as easy or as fast as what people think it is. And I think about this with regards to foods as well, because there's a lot of curiosity about what foods people might eat and also their baby having colic. Like I know that's a big sort of misconception as well of, you know, cutting out things like garlic and onion and you know, chili and all these things if your baby has colic, for example. Now, obviously, I'm not referring to like
Yeah.
intol
Very.
yeah,
Yeah.
protein mediated allergies and things like that, because I know that that's slightly different. But can you touch a little bit on that just briefly?
Yeah, totally. But they're actually not that different, because again, it's the size of the protein which
Yeah.
tends to be the issue. So most things aren't going to affect your baby's digestion and their temperament. Okay. So again, trust your instincts. You will know when your baby really doesn't tolerate anything. But the way and the amount of the food or the protein or whatever part that actually gets broken down and passed into the milk is minimal. So I wouldn't stress about those things. If you notice a pattern, then do it. But if you've Googled and you've seen, you know, that you know, somebody else, this didn't work for somebody else, people are so it's a hard time to navigate. And we cling to things. When I think of some of the things that I got obsessed with at the time, like me and one of my friends had babies around the same time, and we just constantly laugh at how obsessed we were with certain things. I mean, we've all been there,
Yeah.
right? And
Mhm.
and it's so funny how it just goes, and you're like, wow, now I can recognize how you know, a bit
Mm.
When
strange
you
that
see
was.
other mothers like that, you're like, I get it. It's
I
okay.
to yeah, you
The
totally get
phase,
it.
you'll get it. You'll
Yeah.
grow up, you'll realize, yeah, yeah.
That's it. And I remember sometimes being like, oh, it's because I didn't I put the left leg in first instead of the right leg, you know, and that's why she didn't
Yeah.
sleep. You know, she didn't sleep for 45 minutes as opposed to this amount of time. So it's the same thing with food. Very little you're doing has got to do is the problem. It's actually what their body is going through. Again, we forget how much development they're going through.
And
And
their systems are so immature and they're,
it
you
is.
know, it's just there's so much development going on. You think about, you know, when a baby's born, like how sterile they are and they're exposed to all this bacteria and they're just navigating, their bodies are navigating so much. So I
And
think
even in the
just
gut, like I don't think I put this post up yet, but because I'm still just sitting and doing things on it. But about the infant gut and the way it develops, it's actually fascinating, and it wasn't taught to me in school. Like what we learned was about disease. So we learned about the big bad diseases, but we never studied how the infant. And I actually been talking to one of a couple of my peds friends about this as well, and they're like, no, we just don't cover this at all. But even, you know, the reason why they did we talk about this last time? Tell me if I start being repetitive. But the reason why they poo 6 times a day is because of the maturity of the gut. It is also what's in the breast milk, but it's also because of the maturity of the gut. And then around 6 to 8 weeks, you'll notice that'll slow down because again, they've hit one peak of maturity. Then all the colic, and I've got lots to say about colic. You know, you'll notice again that colic resolves at 4 months, but guess what else has happened at 4 months? The gut has matured. So, you know, we are bombarding them sometimes with lots of different things, and always follow your advice and keep up with the weight gain and all of that. But we just need to take a little step back from
So true.
yeah, from all that and understand how much so many things the growth. I never get sick of seeing a baby that I've seen from birth then develop. And I'm waiting for the day where I'm like bored of it, you know, but it's just incredible, you know, seeing like even just holding up your neck takes so much strength, you know, and then even like getting your hand to your mouth is another huge thing. And then being able to process the reason why it's exclusive milk for 6 months, whether it's milk or formula, is because their gut can't handle it. They do not have the processing capacity to process solids. It's not like a random myth that we just made up. It's we cannot process it. Then all of a sudden we can process it, and then all of a sudden we can change what we can process. Yeah, anyway, I could go on about this forever. Yeah. Next question. Let's go. Let's go. Keep going. Let's keep
Such an important reminder about, well, I'm not going to speak about this today, but in terms of the timing of everything, you know, when it comes to milk, solids, the type of foods, allergens, like timing is so important, and following evidence-based guidelines about these things because they're there for a reason.
Yeah, and also
And
even
vaccines.
I do say this, and I may sound crazy when I say this to patients, but you know, we take sitting and crawling and walking and standing for granted. But you know, if somebody suddenly was like, oh, you know what, I developed wings and I could fly, we would be like, oh, that's incredible. Like
Yeah.
your body must have gone through an insane process to do that. Yet we don't understand. And we kind of just we're like, yay, we want them to get to the milestone, but we don't think about what is happening? What is the process behind this? And giving them their time. And that's also for those who want their babies to do things faster. You know, just I know there's so much pressure for everything to happen fast, but yeah, and always, of course,
Appreciate what the body can do first.
appreciate how incredible
Really.
they are and how incredible we are. And yeah, anyway, yeah.
I love that. Can I just add an extension to our chat about medications, because I had a few questions about ADHD, medication, stimulants, and breastfeeding. I'm not sure if you know too much about that. I've been advised that stimulants are not safe during breastfeeding because they do pass through to breast milk, and then even during pregnancy. It's interesting. We don't have to go talk about pregnancy today, but I do want to add that typically stimulants are not recommended during pregnancy. But do you need to? Is
there a dragon? It's a dragon still. No, our kids both love the same dragon. Toothless, yeah.
He's grabbing one of his toys.
I don't mind if he wants to come.
Should I wait for him or do you want me to continue?
No, continue.
Oh, okay. Yeah. So I know that that's sort of standard recommendations, but I also know that there are psychiatrists out there that do prescribe stimulants, specific stimulants or at specific strengths during pregnancy. And I'm aware that there's one small study. I was listening to a podcast about this from an obstetrician gynecologist that works with ADHD a lot, that there's a small study showing that, I can't remember which stimulant it was, but anyway, that it was apparently helpful during pregnancy for ADHD women. But obviously with this concern, I know that's a whole rabbit hole, the pregnancy discussion, but I'm curious if you know anything about ADHD medication and breastfeeding.
I do. Something I'm quite passionate about actually, because I attract a lot of ADHD patients. And okay, so you need to find the right psychiatrist. And if you find a breastfeeding medicine doctor, they've usually got a relationship with a psychiatrist that is comfortable with discussions about this and prescribing it. It is really important that anything that is happening for you gets managed and treated. So if you need those medications and you have ADHD, it's important for that to be addressed, especially we're just talking about postpartum right now, right? So there are ways to manage it, but I want people to feel secure in that they should have a good relationship with their doctor or with their psychiatrist, and they can work it out together. What do they need? You can change the timing of your feeds depending on what type of stimulant you're taking, if it's really, really a problem for you. But even then, there are studies that show that it is safe to take. You will find most people will avoid it. Most psychiatrists even will avoid it before 6 months. But it is safe to take. It doesn't. We haven't got any evidence that it causes any impacts on the developing brain. I'd have to look up the RID. Can I quickly do that for you?
Yeah.
Let's do
Yeah,
that.
my understanding that it was generally a bit more sort of theoretical, and obviously testing on pregnant and breastfeeding women is obviously there's ethical concerns there. So I always looked at it sort of from that perspective that, but I could be wrong. So
There is
it's a
the
very interesting topic because I do know quite a few women that have taken stimulants during pregnancy and breastfeeding, and I think it is a case by case scenario of how well managed and your support systems are, and also your mental health, because yeah, it's going to be impossible to sort of be a good caregiver if your mental health is also not in a good way. So I think it's finding that balance.
Yeah, I'm struggling to find it, but I think it is below the 10%. 6% is what I'm remembering off the top of my head, but let's leave that out if I can't verify
So you're
that.
saying anything above 10% can impact the baby, anything below
It
10%
can
is
get
safe.
passed in larger amounts and it can have an impact on them and their organs. Now, stimulants are a little bit different to something like paracetamol because the way it impacts the body so even if it has a small amount going through, that can have an impact on a developing infant. However, from what I see in practice, most of my patients that need it, we are very happy to support them in taking their medications when they have ADHD. What I would want to be very clear about is if you don't have diagnosed ADHD, that's when it's problematic and dangerous. So,
Mm.
because again, people taking stimulants, they're taking it because there's a difference in, neuroanatomy, neurobiology. So there's a reason to take it. It's not like it's not taking it in the original way people were taking stimulants. So
Yeah.
yeah, it's very different and it's really important. And like you were saying about yes, having, so many friends, it's a very careful balancing act. I have patients who um have severe psychosis as well and have serious psychiatric conditions. And in their pregnancies, we have to carefully manage the medications, and they've done really well. It's the key is support, and again, even as the doctor supporting them during the pregnancy and then after the pregnancy, I was always like, don't feel any pressure. You don't need to breastfeed. You can just go and, this is how we can do formula 2 because of the mental health. So it wasn't about the medication. It was about the mental health. I didn't want her to feel that pressure. And so many of them do really well actually with breastfeeding and have that protect their mental health for a short period of time. So it's such a complex thing and it really depends on the support structure. So with ADHD, I think it depends on your support structures. You need to have a good relationship with your local doctor, your GP. You need to have a good relationship with your psychiatrist. You need to have a good support system around you. And you might have to trial a few things. But yeah,
Yeah.
so that's my kind of.
Does that actually you just sparked my curiosity now? Have you had any experience with patients on opioids, the prescription opioids?
Yeah. So that's kind of not really, that's a different thing. So drugs of dependence or the drugs that are used recreationally, yes, what would you want to know specifically?
So how that impacts
Yeah.
I guess,
That has a bigger impact because that
yeah,
gets
and
passed
how have you
through.
seen it impact the children's
Which
development?
opioids are you talking about? Because that's a huge class.
So let's say, for example, something like Targin.
Yeah. Okay. Again, it depends on how much they're taking. So if they're taking Targen or an endone, you can
Yeah,
get
yeah,
huge doses of oxycodone
yeah.
in this. You can see babies develop dependencies to different types of opioids.
Hmm.
So again, we're talking at an extreme end of the scale. We definitely do not. There's not many things that I don't like in breastfeeding, but we would not like opioids in a breastfeeding mother because the risk is even in anyone who takes it, it has the ability to depress the respiratory system, and in an infant, that's super dangerous, right? So we do not want anything that slightly reduces or hampers a baby's respiratory instincts and reflexes. Yeah.
Yeah. Such a great reflection there. And I was just reflecting on what you said before about ADHD. And I think I was chatting to someone on Instagram about, you know, the being touched out during, especially with, you know, neurodivergent women having a lot of these sensory, like negative sensory experiences with breastfeeding as well, and how medication might help to mitigate that for some women, and that looking at it from a holistic perspective, and that overall benefit of breastfeeding, if they're supported, can be really beneficial, even if they're taking the medication to support them on that journey. So I think
I also want to add something in there because there's a lot of negativity out there. Well, maybe not negativity is the right word, but there's a lot of like, oh, they're going to be at a disadvantage as parents because they have X, Y, and Z. And I have a lot of my ADHD mums do amazingly well, and there are parts of the ADHD which lead to them doing really well. So ADHD, people with ADHD can sometimes hyperfocus, and that means they can engage with their children when a lot of people find it super boring. So they actually can do really, really well with a toddler. So yes, you might get touched out, but there are elements where you will find it easier than a neurotypical person, perhaps. Another thing which I don't like to see is sometimes with that, you know, that disconnect that they can have with their own physical sensations.
Yes.
They come in with shredded nipples, and they keep breastfeeding. So for me, that's always it's a ding ding for me. Like, does this person need, if they aren't already diagnosed, I'm like, do we need to think about that later? Because most people cannot tolerate that kind of pain. And they do quite well with, I don't like the term extended breastfeeding, but I have quite a few that have breastfed beyond, you know, 18 months, 2 years, and things like that. So I want that to come out as well as a positive.
Yeah. I'm actually loving it at the moment. I'm 15, she's almost 15 months postpartum, and it's been amazing. I think it's been deeply regulating for both of us, because it's just that sort of slowing down, that oxytocin. It just feels really nice for the both of us. So
Yeah. And so I want that positive thing about like ADHD, that even though there can be challenges, that it's that they can do really, really well as well in unexpected ways. We need a lot more research on it.
Yeah. Before I forget, I know you wanted to ask her about the benefits of extended breastfeeding. DMER. So since we're talking about ADHD, dysphoric milk ejection.
DMER. Yeah. I thought,
Yes.
Yeah.
So I experienced this a few times when I was breastfeeding in the early months. It did go away, but I'm curious. I'd love to hear, or maybe you can tell our listeners what DMER is. But I'm very curious about the connection, or maybe the increased predisposition for ADHDers or neurodivergent people to experience things like DMER, because I was reading about that sort of sudden drop in dopamine associated with, you know, the oxytocin, with the letdown, and I was wondering, you know, ADHD women probably more at risk of things like DMER, and I was the only person that I knew that experienced it, and thankfully it started to fizzle out after about 6 months, but it was actually really impacting my quality of life from about 6 weeks postpartum, when I got my period, to about 6 months postpartum. So in that phase, I remember saying to my husband, I said, if this doesn't go away, I'm gonna cease breastfeeding, you know, or I'm gonna go on the pill to keep you know, or whatever. So yeah, if you don't mind telling our listeners a little bit about DMER, that'd be great.
Yeah. Sorry that happened. DMER is it's a lot, you know, because you can have multiple letdowns in a day. It's not just when you're breastfeeding. So you can feel these feelings, and it has such a range of symptoms. So, okay, so first let's go back to basics. What is DMER? DMER is a dysphoric milk ejection reflex. Again, we need better naming, but that's what we've got for now. Wasn't really known about till the 2000, I think early 2010s. So I think that the first case report was, I'm probably wrong. I'm definitely going to be wrong with this, but something like 2011 or 2013, somewhere in there was our first case report of it. Okay. And the key thing to know is it can present in so many different ways. You could have nausea, you can have a sense of doom, you can have just this dread about, oh God, I have to breastfeed. It can come as a funny feeling in your stomach. It can come as tingling. It can present literally as any way, as any physical symptom. But the key thing is it will go after 120 seconds or 2 minutes. So as soon as that letdown happens, that should be the relieving of it, because it is related to the reflex, as we said. So that the oxytocin release causes this other drop, which results in the feeling. Now, as to are people, we do notice that I notice a lot of people with undiagnosed, untreated anxiety have DMER, and
Yeah.
often quite a few people with undiagnosed ADHD as well. And it's absolutely like it's awful, because it's just multiple times, and it's not like, oh, okay, I feel a little bit sick. It's like it's like this whole, I don't know how else to describe it. But
Actually, the first time I'm hearing about this, by the way.
I used to experience
I have
it
no idea
only
how
only
really?
only during menstruation.
Oh,
So
really? You got it even then?
that was when I mainly used to experience it, and it
Oh, I
was
have no idea how that would work. Like,
Yeah.
what is it?
so when I
You
so
just
when I
get
was on my period
yeah.
is when it was so severe. I can't even I used to bawl my eyes out.
Like literally for like a minute and a half.
So I would be sitting, and so I never got a formal diagnosis. I diagnosed myself, by the way, but I knew it was when I looked into it, I knew it was DMER. But I'd be breastfeeding at my in-laws, and
Yeah.
like let's say I just got my period, and then even before I'd breastfeeding, I have those feelings like you said, the nausea, the dread. Oh my God, I got to breastfeed. And as soon as she'd start suckling and that letdown would start, I'd have these intense I even feel it right now in my body talking about it.
Oh, I'm feeling it for you. Yeah.
Yeah, I used to have these really intense feelings of sadness, overwhelm, and I couldn't stop crying. So she would be suckling, and I'd be like, "Ah, ah," and then my husband's like, "What's wrong? Are you okay?" And like everyone's like thought that maybe the blues had gone away because I was 6 weeks
Yeah.
postpartum. They're like, "Why are you still crying?" And I just couldn't control it. Anywhere I'd be breastfeeding on my period. I would just cry and just feel this sadness and that nausea and the sensitivity of the nipples. And
That's crazy.
it was terrible. So I remember,
Literally the first I'm hearing.
But then it would go, it was only on your period?
yes, it was only
So you
during.
didn't have it in the first 4 months?
So I started menstruating. So I got my
Three,
first period 6 weeks postpartum, and then I got it really regularly. So every 4 weeks.
But you didn't experience it in the 6 weeks, the
No,
first 6 weeks?
no. So the issues that I experienced initially in the first 6 weeks were more like, like there was a bit of pain with breastfeeding, and I had like milk blisters and other things like
Yeah.
that. But not like when during this letdown period situation. So, and this was only during menstruation. It was so weird. Um, And I didn't know anyone that experienced this. And the only way I could sort of reconcile it was, okay, like my hormones are all over the place during my period. This is only happening though during breastfeeding. This is not happening any other time. So anyway, I don't know, maybe it doesn't satisfy the criteria. But yeah, it would only happen sort of on my period, but it would be that full 6 or 7 days. And then even now, leading up to my period when I'm breastfeeding, that there's still that sensitivity there. There's not the overwhelming sadness, but I still experience that maybe a very mild version of like a bit of discomfort. Actually, last week when I had my period, did feel a little bit sad during breastfeeding, but it wasn't like nothing like before. But yeah, and I wanted to share that. I know, I love your reflections on it, but maybe it's not your standard sort of situation, but it was really bad.
Yeah, look, this is such an emerging area, right? So,
Yeah.
and I never want to dismiss anyone's experience. It doesn't technically fit the criteria for DEMA,
Yeah.
but what you're saying during your menstrual, like during the period, it it does fit it for that particular time. But I can't explain
Yeah.
why hormonally. I'm
Mm.
going through. I love all the hormone
Yes.
stuff,
Yeah. Yeah.
and I'm
Yeah.
like,
Yeah.
but what? Why would the dopamine drop be
That's
bigger?
what yeah, because you think, oh, menstruation, don't like estrogen's higher, like,
Not at that period of time. So
yeah,
so your estrogen is only high as it's only high at this part, then that
as it
triggers
comes,
off your FSH and your LH, and then it will drop down as well. And then you'll get actually be having a rise in your progesterone, which inhibits prolactin. And like I can't work out how.
yeah,
I really want to look up this
yes,
and see if this is recorded, because what you're saying definitely sounds like its own discrete situation, and I'm like, oh my God, is this something that people are going through? And
mm,
we're just terming it as like, it could be PMDD, or it
Mm.
could be just no, like, because we all feel postpartum, our periods change as well, right? So
mm,
could it be part of that? But yeah, so it doesn't technically fit the criteria for DEMA, because again, it has to come on with letdowns. It gets relieved with that within that 120 seconds.
yeah. It
And
did used to go away, yeah,
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 but
but so crazy.
it sounds exactly like that. But yeah, and it doesn't make sense that it didn't come in the first 6 weeks. So that also doesn't make
Yeah,
sense. Yeah.
very
Anyway,
interesting. I just want to share that. Yep.
Yeah,
But you
thanks.
wanted to ask
interesting.
Miriam
No,
about
it
the
was just a
benefits.
follow on to you mentioned breastfeeding and what was the context of the last part?
Surprising that I should
Oh,
mention
just
breastfeeding.
about she was talking about ADHD and
Oh, how
have
can it benefit some people, I guess. And you mentioned how you enjoyed it.
still enjoying breastfeeding, and then we wanted
Uh,
to ask you about the benefits
so
of extended
yeah,
breastfeeding
is
beyond
there
the standard, 6 to 12 months.
I've actually heard you spoke about this on your TikTok. So and it was very fascinating to know that there's cultures out there that breastfeed for like 6 years and things like that.
Yeah, I'm very curious
So
about
I
this
was
because
like, yeah,
I feel like there's a lot of judgment towards women that do extended periods of breastfeeding. I actually had someone say to me the other day, I won't mention who it is, but they said, "Oh, do you think it's a good time to wean now so that she can eat more food?" Because I was mentioning that, like, my daughter's not, she's going through a bit of a fussy phase at the moment. And then it made me really upset. Like, I didn't say anything like to her at the time, but I just thought, like, why are you telling me to wean? Like, that's not
yeah,
your business. So, and I thought, like, I was like, oh, she's only 15 months. She's still a baby. So,
maybe.
yeah, we'd love to hear about, what some of these benefits are beyond that first, 6 months, 1 year, because we know a lot of those rates drop at 6 months and then even further so what are the benefits?
But it's also really interesting that, like what you're saying, in the context with which she said that, right?
Mm,
Yeah,
Like she said, oh, you said she's fussy. So the breastfeeding is the problem. Like, why is that the go-to first?
yeah,
Why would that be? For me, I'm like 15 months old, which teeth are coming out? It's the middle of winter. Do you
yes.
have older siblings? Like, is there viruses coming home? Like that's actually probably more likely to be the cause of the fussiness than anything
Mm.
else. And
She
so much
does have molars coming out. So,
that's what the fussiness is, and we've got to trust them when they don't want to eat. That it's so they get in so much pain. Um, they shouldn't, according to one of my friends who's a dentist. They're like, "Do you remember your big teeth coming out when you're an adult? Did that hurt?" And I was like, "No, it didn't." And then they're like, "Well, so why would baby teeth hurt?" And I'm like, "But it's different. It's the first time they're anyway." We know that it looks like it hurts, right? And they behave different. Don't let me get distracted. Wait, what were we talking about? Yes. Okay.
extended breastfeeding.
yeah.
So,
Yeah,
yeah, we should change the terms though, because it's not actually extended breastfeeding, it's just breastfeeding.
yeah.
Okay. But I know what you mean. The first time I heard about it, so I have one of my mates, she's what I was telling you about that we got weirdly obsessed with different things. She is the person who put me onto this field because she told me all this breastfeeding facts and I didn't know any of them. And she told
Mm.
me that in Mongolia they breastfeed up to 6 years. And I hope I'm being correct. Please, anyone who's listening to this who's Mongolian, please correct me if I'm, you know, uh, being rude or
Just go
anything like
for
that.
it.
Yeah. But it's seen as such an honor that if there is excess milk, somebody will get that, and it's seen as a treat for you to get that extra milk, which I know people might balk at in our society, but it's actually
They
really,
understand the importance of it.
yeah. And I mean,
Yeah,
like, isn't there something like,
Mm.
we might have to
honestly.
cut this bit out, but like, isn't there something like, people have the DNA of Genghis Khan. Apparently, 1 in 3 people in the world have the DNA of Genghis
You
Khan.
go. Free breast milk.
Yeah. No,
That's
because
crazy.
they were the most strongest, kind of the biggest conquerors at one stage. I mean, we shouldn't be celebrating conquerors, but anyway, their culture did a lot. Amazing. So, anyway, yeah, I've gone on a tangent. Yeah, let's cut that bit out.
I
But
Just
like
the
that. I would
benefits.
keep that bit in. I
Yes.
like
no,
that.
no,
So
no.
We want
Let me at least get
we want
let,
leaders. So breastfeed. If there's a great leader, get his wife to breastfeed your
and
child.
they're great horse people. Like
There
they're,
you
I
go.
love horses as well, and like the
You get
Mongolians
all
are
those skills through
the
breastfeeding.
best horse people. But again,
There we go.
I feel like I'm just giving the typical trope of the culture rather than the
Yeah.
the general thing. It's like when people are like, oh, do you like chicken tikka? And I'm like, like that. Okay, so where were we? Okay, so breastfeeding. Breastfeeding is hugely beneficial, right? So we know that through all stages, it's hugely beneficial. And it's also about more than milk. I won't go on about that here because I know you want to know the technical things, but it actually is also about the emotional connection and the safety. Again, their brains, they're still developing their attachments until they're 3. And even if we can't be with them during the day because we're working paid work, or we're doing other things, or we're busy with other kids, sometimes that little bit of connection can just give them that sense of peace, and it slows you down. We're not supposed to be running around the way we are, like the 3 of us trying to find time and all of that, right? Like, we're not supposed to be doing that. We're supposed to be able to take it a little bit easy. And so that's a good way of looking at it too. There was also something else I wanted to say. It's gone from me now.
So the connection and the attachment.
Yeah, the connection, the attachment. But then also, someone actually commented on that one, and I hadn't thought about this, that people don't realize that breastfeeding changes throughout the
Yes,
stage.
correct.
How would you know? So,
Exactly.
and
It adapts. So
yeah,
fascinating.
but that it adapts, but also the way they breastfeed at 15 months is very different to how they're breastfeeding at 4 months. So if in this society, if most people are stopping around 6 months, then they don't understand what it looks like to extended breastfeed. Oh, sorry, it froze, did it?
Fine, you came back. Yeah.
Yeah. So they don't understand what it looks like to breastfeed at 2 years or 3 years. And it's not actually like the baby
holding a baby and sitting on the couch.
Yeah.
It's like suckle, suckle, suckle. All right, I'm going to go play now.
Exactly. And so it's like, it's very quick. And I thought that's a really important point for people to know, that, it might be a minute in the morning, a minute in the night. It can also be, half an hour of connection, talking time, gentle affection and all that kind of stuff
It's
as
almost
well.
like touching base with their parent. Like, they come literally, I remember my son would literally be like, 1, 2, and he'll run off.
That's it.
Like, you're still there. I'm still connected to you.
Yeah.
I think did you
and then
even
they
get
actually go.
some?
Yeah, they do.
Did you even get some milk in, bro?
Yeah.
I thought that to Ileana yesterday, because she literally came on for like 5 seconds. She came off and then she was babbling, and I was like, "Yep."
Yeah.
They're there,
You
Mum.
barely
It's
drank,
there,
but
the
okay.
milk's there.
Yes.
I gotta, it's
Yeah.
But that's actually why as well. Sometimes when we're weaning, we don't even know. Like, I don't even remember I didn't actually wean them as such. They just stopped having it as often, and then I stopped offering it. So even though I get a lot of questions about how do you wean, and when we wait for that kind of past 12 months period, they're often too busy. So they want to explore things. So they might just
Do it
come.
themselves.
They might come on for a couple of minutes, and then exactly what you're saying, like, oh yeah, I was a little bit thirsty. My water's too far. Let me just go to the quickest source. So they may not even be trying to get nutrition. They might be like, hey, I just need to just wet my palate and then keep going with whatever I'm doing, right? And that's fine. That's okay too. So I think that's a really important point.
Delectable.
Yeah, exactly. Like, and you're like, oh, I'm giving you all this good stuff, and they're like, yeah, anything would have been fine,
Yeah.
But the actual benefits, the biological benefits, are immense. And again, if we always have to say, if people aren't able to do it or don't want to do it, that's not to put pressure on you. You've got to do what works for you. But we've also got to get the science and the facts out there so that people can make informed choices about.
And we also got to reduce the stigma as well, because I think, like, I
completely.
see so many women posting about breastfeeding, until like their toddlers are older and things like that, and the comments are so nasty, so nasty. In their comments, people saying like, that's a grown child, that's an adult, that's a man,
That's child
like,
abuse.
or like, this is so bad for his self-esteem, or this is bad for his development, and it's like, it's none of your business. Like, how do you have the energy to go and,
But it's
interact with someone?
projection.
It
It's
is.
their own deficiencies, and they're like, well, I wasn't able to do this. I don't want somebody else to be able to do this. I don't want to feel bad about it. So that's really where it comes from.
Well, I actually think
But yeah.
it's really interesting, and this is where we're going to derail ourselves, guys. But it's actually a really interesting reflection on culture. So I always really love seeing
100%.
those kind of comments, because we really see why people think the way they do, and why
Yes.
why do they feel that way.
The first one, yes.
The second
No.
Okay.
It was wrong.
Sorry about that. Yeah.
No. So it was really interesting. When I was when with my first kid, one of my mates had come up from the country, and I'm going to tell a funny, maybe a little bit inappropriate joke there. I don't know. Anyway, and he wanted to play a prank on his friend, right? And this guy's a radiographer, and he's like, I want to play a prank on my friend. Can you give me some of your breast milk so I can put it into his tea? And I was like, yeah, sure. And I was like, actually, yes, I gave it to him. But I was like, but actually, why is that a prank, but a random cow's milk is considered so much better, right? Like, so I think that's a really interesting thing. If your kid's drinking milk, everyone's like, oh, that's really good for them, like cow's milk.
Calcium, yeah,
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 yeah, yeah.
yeah, yeah. All of the stuff. It's like it's amazing for them. But if they're drinking breast milk, and so it really just speaks to we have a problem, a cultural problem with how we view babies and how we view parents and mothers specifically. So
Mm.
and that's the issue. And again, is it because we've sexualized breasts and therefore if a baby's breastfeeding somehow that's sexualized? Are we sexualizing children somehow, and putting this on them? Like, I don't like when people are like, oh, that's his girlfriend, that's his boyfriend when they're like one.
Yeah.
And I'm like, I know maybe I'm being
Hold up, that's my baby.
yeah, yeah, but it's like it's a child, right? Like, and I know that it might look cute, but it's still it
I'm
just
with
doesn't make
you.
sense to me.
That
Yeah.
Yeah, actually, I saw a post and you just reminded me now. Is there any benefit for adults drinking breast milk?
That one, I mean, again, I would put it down to is there a benefit to us drinking cow's milk? I mean, like, yeah, like I
If you
don't,
have an oversupply, let's say, for example,
yeah.
and
I saw this bodybuilder
you know,
actually, he was buying breast milk from
It's actually I don't like that. So I don't
yeah,
like the fact that people are. I feel like they're making a commodity out of
yes,
parents and milk and all of that kind of thing, which I don't like.
yeah,
Uh,
Mm.
and also, again, like yeah, colostrum is amazing, but you've already got your gut seeded. So like I don't understand. Like there's a big market. I didn't know this until I came into social media. So there's a huge thing about like in the health space. Not, we should call it health space, but
wellness. Let's talk about wellness.
yeah,
Yep.
almost.
but is it wellness?
Wellness.
It's a particular space, but they're going into um, consuming things that we're not designed to consume at that stage. Is it harmful? Probably not. Like I don't think it's harmful. Is it going to be beneficial? I don't know. Don't have any evidence to support that. If you're all sick and like would it benefit you to drink your own milk? I mean, you're already making the antibodies, so I can't see how it's going to change your own body. What about like your partner or sister or something? Like again, I just don't think it's
Mm,
harmful, but I don't know if it's going to benefit anybody. But there are
mm,
amazing things in it. So
mm.
we do have amazing cells, and we don't even know all the different types of cells that are in it yet. So I'm
So,
probably giving that boring kind of doctor answer there, which is like, well, it's not gonna, there's no evidence it's gonna harm you, but there's also no evidence that it's gonna do any good.
mm,
And there probably is some amazing stuff in there that I don't know about. Yeah.
mm.
Yeah, yeah. Such
Interesting.
great gems.
Yeah.
I could listen to you talk all day, really, Dr. Kavita.
Yeah.
Um, an extension of some things that Miriam asked you earlier. So I think you guys spoke about antibiotics and the
Mhm.
microbiome and that passing through breast milk. What about things like nipple vasospasm, nipple thrush? Are these some things that obviously I'm presuming that you've seen quite a bit in practice? What are some things that you can share about these and if there's any sort of gems that you'd love our listeners to know about?
Definitely. And remind me to go back and actually tell you a list of the benefits of breastfeeding, or we can just put it up there. Okay. Like
Yes.
all the different,
Yeah,
like,
maybe add that, Miriam.
yeah, all
Yeah.
the proteins and all the stem cells and all the microRNAs and all that. Okay. So, let's go into nipple vasospasm. Oh, you're really going to just get everyone to hate me, aren't you? Okay. Yeah.
I'm
Okay.
curious about this because my sister actually had nipple thrush and vasospasm in her first 6 months of breastfeeding with both children, and that really negatively impacted her breastfeeding journey. And this was 9 to 12 years ago because she's got a 12-year-old and a 9-year-old, and she doesn't have any really positive memories of breastfeeding at all. So I just wonder if she had gotten support at that time that if her journey might have looked different. So I'm curious, yeah.
I'm sure it would have actually. So, um, okay. Let's go with vasospasm first. This has gotten wildly in my humble opinion here.
Mm,
Um, there, where it's been taken out of context for me is that there is a disease called Raynaud's disease, right?
Mm,
yes.
And so in that particular disease, it affects your blood vessels, and you can
mm,
get vasoconstriction, you can get color change, and it is actually a serious autoimmune disease that has huge impacts on people. Uh,
Yes.
I can't remember what the incidence is, but it's a very low incidence of people that have it. Now, you could possibly be somebody who presents with Raynaud's disease for the first time, and the first place you're going to present is your nipples. But I know it has happened, but it's highly unlikely. So, and again, my issue is, do I have a problem with people thinking something? No. If they think that, I have a problem with people having the wrong treatment for it, and I have a problem with people taking medication that they don't need. And so the treatment for vasospasm due to Raynaud's.
Oh, she froze at the best time.
Oh.
Sorry, you froze at the best time. Sorry,
What did
continue.
I say? What was I saying?
You just froze at the treatment for
Okay.
spasm with
So,
Raynaud's.
Yeah, so the treatment for vasospasm with Raynaud's, or if it's limiting and really affecting you with pain and things like that, is a calcium channel blocker, which is a vasodilator. Okay, and we use that and it can help them, especially because they get it with their fingers, they can get it in their toes, and it's excruciating, right? And again, because it's vasodilating, that can help. But somebody who's breastfeeding, a lot of the people who take it, it doesn't actually help. And the reason is because we're not getting to what is actually causing the issue. What is the cause of a white nipple? What is the cause of pain in the nipple? What is the cause of this excruciating pain? And I did a video on this ages ago, and I've got to put it up eventually. And I need my husband's hand or your hands. Which one of you has a really fair hand?
Oh, is there a bit of color? Maybe your hair's fairer.
Like whoever's got like the whitest, this bit.
Yeah, that's you.
Okay, all right. So I want you, okay, Iman, can you just, okay, so you can put it up there. We can all see the color. Now I want you to press on her hand. Yeah, okay. Now, can you bring it close to the video, guys? Yeah, keep your arm open like that so we can see. Okay, now, I don't know if it's going to do it, but release your finger now. Can everybody see how that's white?
Yes.
See how that's white. Okay, when we compress the blood flow, you're going to get white. Okay, white tip. Doesn't really work on my, wait, where are we? Like,
You're about to spit some big facts, and I'm so here for it.
no, I'm not really about to spit some big facts at all. I'm bringing it back. I'm bringing it back. That's what I like to do. Everything I do is bring it back to basics, basic physiology, basic anatomy, basic evidence. So
Yes.
if you get a white tip, or you've got your nipple turning white, it's often that it's been compressed in the baby's milk. Now, I needed to get, I always come prepared with my dummies and my things here.
Yeah.
But if the nipple is hitting the hard palate up here, put your tongue up to the top up here. And if it's getting jammed in there with
Yes.
stuck, that is going to, you're going to have a white tip.
Understood.
Quickly.
Yeah.
Just like,
Got it.
you know, just if
The same
just
way.
keeps on
Yeah.
doing
I feel
this
like
hand.
so many breastfeeding challenges all come down to latch ultimately.
Comes down to basics. So much comes down to and it comes down to understanding the basics, understanding how our breasts work, understanding how it all works together, understanding how baby transfers that milk from breast to baby. And this is what it comes down to at the end of the day. So I definitely don't want to discount anyone's experience who actually had Raynaud's, and it's excruciating. But again, it must be frustrating for them to hear everybody be like, oh, I had nipple vasospasm and I, you know, as a thing of Raynaud's, when they live with that every day as well. Now, nipple vasospasm, whether it's due to you know, simple compression or the nipple being in the wrong position, or whether it's due to Raynaud's, the nipple is highly innervated, so it's extremely painful. It's excruciating. Okay, any damage there, it's a really highly innervated area. So the pain is intense. Okay, it doesn't matter what the cause is. But the thing is, we can actually have a better way of doing it. So if we just give you that, you know, calcium channel blocker, but we don't get to the cause of it, you're not going to get any better. And you're going to have a terrible experience, and you're most likely going to stop breastfeeding. And who would blame you when you've got that kind of pain, right? So, and even if you don't have that kind of pain, no one ever blames anybody. But the point is that it's a very obvious pathway that it happens. And I have many, many patients that come to me with, I'm having a white tip in my nipple. And as soon as we fix the latch, you know, and there's also often coexisting inflammation as well in the breast, which will bring me on to thrush. Have I kind of answered that, or have I started to go on to the next topic?
Oh, that was good.
No, that was clear. Yeah.
Is there any
Ultimately,
more?
I feel that you're saying you're getting correction and support with that latch and understanding whether it's to do with Raynaud's or not.
Yeah, where it's coming from.
And right, it's a particular type of disease that we actually see that in. And it's really important that we get the specific diagnosis, because otherwise the treatments aren't going to work for you. You know, so we really need to do that. And some people say, oh, when they heat or when they cool it, it can make a difference. And some people notice it in winter. But in the same vein, like I'm actually sitting here. Where is it? It disappeared. I've got a heat pack on my toes because now in my 40s, my feet do that. And I've developed chilblains, which aren't the same as Raynaud's, but I mean, I haven't got them now. But a few years ago, I started to develop that. So it's again, it's about understanding what is the cause of it. And so every time I'm doing one of these, I've got a heat pack during winter on my feet, even though it's it's fine weather and all of that kind of stuff. So I think I've gone on to
Well, yeah, you were talking about inflammation in the breast, and you're going to
okay.
talk about thrush.
So often we'll see as well inflammation. So nipple thrush. This is one that again I have to get onto on my Instagram, which I've avoided. Nipple thrush is way overdiagnosed. And it also again doesn't make sense when you go back to the basics. Okay. So in the evidence, it's not actually clear as a diagnosis. We haven't got evidence to support it, though for the last 40 years, everyone's been saying nipple thrush, nipple thrush. There is some definitely we can see that you can have a Candida albicans abscess. We've seen that. Yeah, I'm not denying that that exists. But most nipple thrush is actually due to inflammation. And when I say inflammation, I mean it will be a case where there's either pumping going on or there is too much milk stasis. And we're seeing there's just a disbalance, like a balance between what's actually happening and what we need to be happening. Okay, so with that, there's so much to talk about with this thrush stuff. So basically, Candida is it's a natural commensal. It exists everywhere. It's on your skin. It's on our breasts. If we swab both your nipples now, you would have Candida on it. And we actually have studies that within the tubules and in the breast milk, it's there. It's there all the time. Does it grow to the stage where we see a thrush on the surface here? Oh, hang on, I can't hear you guys.
Where is it?
Oh, no.
It's just press the side button.
Yes.
Yeah.
Yeah.
It's probably good to distract me from when I'm getting onto so Candida albicans, which is one of the most common organisms that cause thrush. There's anyone in the variety of Candida can do that. It exists naturally on the breast and it exists naturally in the breast. And the problem as well, again, I don't like people taking treatments they don't need, and this is an annoying treatment to take. If you've ever had to take the treatment for nipple thrush, it's super annoying. You have to take you have to put gels on your nipples. Sometimes you have to take oral tablets. You have to, treat baby at the same time. And often we're treating baby when they don't need it. So that's the big thing. So the other thing people will say is that the baby has oral thrush. I've had so many babies come into me, and when I've examined them, it isn't oral thrush. Oral thrush will generally, it's not just a thick milky residue on the tongue. You will find plaques as well. It wouldn't make sense. Why would it only grow in one spot? It would spread. And maybe if you saw it early, yeah, you might have one spot, but then it will go across. And so, and this is something that peds get frustrated with too, because it's so often not oral thrush. Now, of course, there are babies that will see them, but I rarely ever see a baby that has true oral thrush. And I can't even think of the last time I gave a mum treatment for thrush.
And how they diagnose it, just looking at it?
No, the breast, you've got to get into history. With breastfeeding assessments, you cannot diagnose anything without, you need to take a bit of time and you need to really dive deep into what's happening. So what you'll have is it's usually misdiagnosed inflammation of the breast. So it's definitely not mastitis, but it's that spectrum. Remember, like mastitis is an inflammatory spectrum. So they'll have a history of blocked ducts. They'll be full, and they will have, what happened was in medicine, we were told if you have a red and shiny breast, you have thrush. But guess what? You also have a red and shiny breast if it's really painful because you've got inflammation. And the other typical sign we were taught is if it hurts to have a t-shirt on, if it's too sore for contact with clothes, then it's nipple thrush. And it's still it's still there in the RSCGP exams. We'll change that slowly, but it's just not the common cause. The first cause is downregulate that inflammation. Is that person pumping? Are they using the silicone catchers? And are they putting that on too much? Are they pumping huge amounts in the day? Are they do they feel that as the breasts soften, at 6 weeks that they need to pump more to drain the breast, which you can't do because our breasts aren't udders, cow udders that we have. Our breasts are very similar to pigs, so they have a ductal system. And all of our breast milk knowledge has come from, and breast knowledge actually came from cows. Yeah, and they have a very different, they have cisterns. Anyway, again, we've gone on to.
That's so interesting.
Isn't it? It's so fascinating. So,
Yeah.
yeah, because they have cisterns, so they can get mastitis. One of my friends was a vet, and I remember the first time I was like, do cows get mastitis? And she's like, yeah, like it's a massive, massive thing in the farming industry. And yeah, and it's such a big problem.
Yeah.
So, sorry, I got distracted by another funny story there, but yeah, a non-appropriate one. You get me
Yeah.
back on the track. Where were we? Yes. So most nipple thrush, actually, we need to think about down regulating the inflammation, and it doesn't make sense, even from the way thrush grows. It just doesn't make sense that it's
Yeah.
as prevalent as it is. If people hearing this have been told that they have thrush, it's not that doctor's fault. It's not that midwife or lactation consultant's fault. The knowledge hasn't changed yet out there. They need to speak to somebody who is really in this field. It's just like, I don't know what the latest treatment is for men's hair loss, right? Like, this is my specialty, so I know all about it. So it's not that your doctor is giving you the wrong information. It's just the information hasn't updated, and we're going to slowly work on that.
Yeah, so many pills of wisdom. Do you have, I know do you have to get off right now? Can we milk you for another?
Yeah, keep going.
Milk you for another.
I'm waiting. When I hear from them, I'll let you know. Yeah.
All right, beautiful. We don't have too many more questions, but we've got the ones we've got are a bit loaded. So
Okay,
you do
let's
what
go.
you can. You do what you can.
Can we mention Babsies on here?
What's
We
that?
mentioned what?
Can we, I call her Babsy. That's how much I listen. Barbara O'Neill. Can we?
No, we don't have time for. Well, which one is that?
Do not breastfeed until you have teeth, basically, and you have molars.
Oh, okay. That is actually. So can I add that there's a very common belief actually amongst certain people. I've seen this
I
circulate
think that's
online.
a good myth to bust.
I did actually talk about this on my Instagram once.
Wait. Can I? Wait. Okay, let me just write this down. Molars.
Yeah,
I wanna
yeah.
know what she wrote.
So you're saying that Barbara O'Neill said not to breastfeed until you have molars, but I've heard something similar of starting.
Are you saying not to breastfeed?
Sorry, what did I say? Starting solids. What did I say? Oh my God.
You said not to breastfeed. Yeah.
No,
Gotcha.
to breastfeed, not to start solids.
Yeah, to continue.
Sorry.
I can bust that in a second. Yeah, okay.
Yeah. So basically to avoid introducing solids until a child has teeth.
Yeah. Okay.
Look, as a nutritionist, like and a naturopath, I believe that's incorrect because obviously there's a demand for particular nutrients that have to come from food. But
Correct. That's what I was going to say.
That's pretty much it.
And specifically molars.
It's not a long debunk. It's quite a fast debunk, actually.
But it's also an important one because yes, there's that, but we also have evidence for that in absolutely the nutrient deficiency is massive, but also we have evidence in the development of the infant gut. The infant gut can handle it, and the infant gut is able to tolerate all the foods. And then people will say, oh, but will you have allergies and all this kind of stuff? It's a different pathway, right? And so again, we mix up that allergies are IgE mediated issues, whereas food allergies are non-IgE mediated. Anyway, I'm going to go down
it's a rabbit hole. Yes, correct. Yeah.
But yes, we can absolutely say that you do not need to wait till you have molars. You should be adding complementary foods from 6 months. And you should be offering things which are nutrient dense, like you were saying.
Yeah.
However, babies are picky, so don't stress yourself out. Just keep offering things. The important ones, from my perspective, you'll know more about this, but from my perspective, are the iron, the vitamin B12, vitamin D, iodine. What else am I forgetting? Like
they're all the key foods.
They're the key ones. That fat, choline.
Yeah, fat, choline.
Yeah. We want them to have good amounts of that. So, but babies are picky. So I always say to my patients, offer it, but trust the baby. Like keep offering it and let them have what you're having as well. Yeah.
Yeah.
So just to clarify, the question was, is there any truth to not feeding children until they have molars? Not feeding.
Yeah, the clear answer from Iman and me is
to clarify. That was the question.
Yeah. There is no truth to not offering that. It's actually dangerous. Like there are serious
That's an
deficiencies
important
that can
one.
happen. Like even vitamin B12 is really important for nerves. You know, iodine is important for everything.
Yeah.
Yeah,
Yeah.
and you will still get iodine in breast milk, but it's still like if a baby is not feeding enough, they're not going to be getting enough, right? So we definitely want it to be complementary.
Yeah.
Um, yeah. And
Absolutely.
so babies like to try things and yeah.
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 Okay.
While we're on the topic of nutrition, I think the myth that Miriam came across was that, or something that she was reading online, is that our mothers losing calcium from breastfeeding. So our question was, do mothers lose? Is that
It's 500
500?
milligrams
Where did you
a
read that?
day. I
It's
can't
so
remember. This
random.
was ages ago.
500 milligrams a
Yeah.
day of calcium from breastfeeding and
Mm.
20% of bone density. Sounds a bit dramatic, but
Yeah. Okay. So this is a great one to bust, actually. Again, I've got another post sitting in my in my inbox that I've never actually done.
yeah.
So the answer to that question is yes, you do lose some bone density. I can't remember if it's 20% or what the exact number is, but you lose some of that bone density. You resorb that from your bones. However, it's a really clever process, and within 6 to 12 months of weaning, that completely corrects, regardless of your diet.
6 to 12
It-
months of weaning.
Yeah.
Okay.
That's
So people who have a history, we need to watch them, and they might need proper, they may need to go to you and get proper um, replacement.
supplementation. Yeah.
Exactly. But we also know, I could be wrong on this, but we also know that taking in dietary calcium in a supplement form doesn't necessarily convert to increasing the calcium in somebody who's not depleted. That's
Yeah.
right? Yeah.
Yeah.
So it's even what we don't want is parents to be like, okay, I'm going to be losing my bone mineral density.
Oh, let me go take calcium. Yep.
Yeah. So I need to take calcium. It's a natural process. I don't know why it happens, but because everything I try and look back for an evolutionary reason, and most things I can find an answer for. Can't find an answer for this. Can't find an answer for pregnancy, morning sickness as well. Or hyperemesis. Can't find an answer. I don't know why it's so mean, but everything else has an answer. But yeah,
Yeah.
so that returns within that time. And again, what does it mean? I don't know. I'm sure there is more to
Yeah.
it because
I think
everything with breast milk and breastfeeding always has a magic twist.
Yeah.
I think with regards to calcium anyway, it's always good for women to get individualized advice because, the requirements are usually, higher during pregnancy. And some women are more at risk, obviously the women that have history of like preeclampsia and things like that. So, I feel like calcium is an important discussion right from conception all the way
Yeah.
through to breastfeeding.
Yeah.
And I think, particular women might have increased risk, especially if they've got a history of eating disorders or
Exactly.
that.
Yeah.
Then they're going to need more if they've got a history of, like you said, low bone density or osteopenia or anything like that. So
Or PCOS or any of the metabolic
yes,
companies that can.
absolutely. So
Yeah.
I love the way you clarified that, and I think that's going to be really helpful for a lot of people. And a good reminder that just not to supplement just because you read something online, and to always
Have we heard about that Blackmore's court case,
yes,
the B6, right?
basics,
So, and
yeah.
I've been seeing so many people come in, and because I like to check on bloods when at different times of postpartum, I like to do one set before 4 months, and then I'll do another set around 12 months. I don't want to over investigate, but we'll do that then. And people are taking lots of supplements that are just wildly unregulated. I've been finding a lot of high B12. I've been finding a lot of people taking a lot of things that they don't need, and actually high B12 is harmful. The Blackmore's one is about B6, but yeah, and again, you're spending so much money on things that you may not need, so we've got to be careful about that. Yeah.
Well,
Individual
following
advice
on to
is
that,
fantastic.
yeah. Well, what are some vitamins that breastfeeding mothers might need during pregnancy, and should they be taking a multivitamin of some sort?
So the way I approach this, I'm not an expert in this. It would Iman, a nutritionist, they're the people who are really going to know exactly what you need. But I can tell you the basics. I can tell you what the baby needs and what mum needs.
Yeah.
And we don't really cover this very well in medicine, I should say. But it's iron. We need to have really good iron because as well the baby gets their iron from your iron. So that's really why I do that blood test. If you've had a risk factor, I will do a blood test at 6 weeks when you come in. So a risk factor would be postpartum hemorrhage, we have pre-existing anemia in pregnancy, then I will do a blood test for everybody at 6 weeks to check that. Otherwise we can wait to 4 months, but iodine, so important for everything because until the baby, they may not be producing enough yet. So we need to make sure that we have iodine really supplemented. And
Folic acid.
But yeah, but it's a really interesting thing. So have you heard of like postpartum thyroiditis?
Yes.
Yeah.
Yeah.
So I find it fascinating that in some people, and I wonder if everybody does this to a degree, if the body somehow knows you're postpartum, there's a placenta out, and it throws you into thyroiditis so that you end up producing more T4 and T3, which is what you need to then, do all the stuff that does. And yeah, anyway, it's just a really interesting process. And then it corrects itself. So you can see people with these high
Yeah.
numbers.
Yes.
So that's another reason why I test them, because if you're taking a supplement and you're already high, we don't want that. We don't want you to be
Yes.
taking that supplement because you're already high.
Exactly.
But then it will correct usually around 7 to 8 months is what we study that. And then you might go into
Yeah.
hypothyroidism, which is also one of the peaks for the postpartum depression, baby's still cute, but everyone's kind of over you having a new baby and you're on your own in the trenches working out.
Yeah, yeah. No, nobody visits anymore. No,
Nobody
no
visits,
meal get dropped off. Yeah,
Yeah,
it's
yeah, yeah.
withering away
Exactly.
like wilted spinach in the back of the fridge.
Yes, exactly. Exactly, right?
Yeah,
So that's where that second part where
yeah,
it happens. So, but oh yeah, you asked me what's essentially.
Vitamins.
Yeah.
Yeah.
So yeah, the essential vitamins are the same ones that we talked about there. So I always test your iron, your thyroid, your vitamin D, vitamin B12. There's probably a whole lot more, but I don't know how to assess and test them.
Oh, you said
yeah,
vitamin D,
yeah,
yeah?
I know zinc has a big impact on infant health and maternal health, but
yeah,
I don't know how to manage
yeah.
that properly because I just haven't got
I
teaching on it.
I'll add the nutrition
Yeah.
piece, but I agree with all that. And I always say, like, everyone should at least be on a standard, postnatal, like multivitamin, like as a minimum. And then the rest is on a deficiency or needs basis. So, your iron, your vitamin D, your B12, even things like choline, omega-3s.
Yes,
They're
yes, yeah, very important.
Yeah,
Yeah,
because
yeah.
that obviously really important for their development. And if you're not getting enough of that through the diet, then it has to come from an external source. So they're often the forgotten ones, I find.
Yes, I definitely.
Yeah, but it's so fascinating. I love how much this area is growing and just how much more, health professionals are talking about it. We've got one more, maybe one or two more, and that's it.
Yeah, yeah.
Yeah. This is it's a big one. It's a big one, but
Wait, before we do this one, can we quickly do the benefits of breastfeeding? Let's say
Yes,
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 yes.
please.
Let's do it.
Okay, the components of breast milk after 12 months are immense. So you actually see increase in some of the proteins, the immunoglobulins, things to help seed the immune system. We have microRNAses, which have the ability to turn on and off genes for different diseases.
Yeah,
Yeah, I know, it's incredible, isn't it? You can see stem cells, you can see different growth factors. There and people think of antibodies, but your body produces antibodies constantly. So if you face a virus, you will produce antibodies, and then when you're done with producing a response, you stop producing that. So your milk is constantly changing in response to your environment, baby's environment,
yeah,
and all of that. So that's another thing. If you're sick, what should you do? Should you breastfeed your child? Should you not breastfeed your child? Breastfeed them, because if you're sick, you've already started to produce antibodies. Give them those antibodies so that they have a better chance of fighting off the illness. And we know that the extended breastfeeding, which I don't like that term, but anyway, it has so many benefits for baby. It reduces incidence of maternal disease as well. So there is
Yes.
I've read about that cancer,
Yeah.
certain cancers.
Yeah.
Yeah,
certain cancers, but even something like diabetes, what we call it's a dose-dependent response, and that goes with the time of how long you've been breastfeeding. So if you've been breastfeeding if you had gestational diabetes, or you have high risk factors for diabetes, and you breastfeed up to 4 months, you reduce your risk by a certain number. If you
Yes.
breastfeed for 6
Yeah.
months, reduce it further, and if you keep going, you reduce it almost the same as the relative population. So it has a huge impact there. Autoimmune diseases, it has a huge impact as well. Yeah, so the benefits are endless, and let's not also discount the emotional, mental benefits as well for baby and for parent and the whole family.
secure attachment, all of that sort
Yeah,
of stuff.
yeah.
Yeah.
And you can breastfeed when pregnant as well if you want to. It's not a problem.
I've always wondered about whether the like lactocytes and just the production of breast milk during pregnancy, does that still, I know some people still breastfeed, but I used to have this preconception that the milk doesn't produce the same. And I wonder if that's a myth in and of
Look,
itself.
a lot of our instincts, you know, a lot as well. So Look, the milk does change in flavor. So a lot of babies will self-wean when you're pregnant in that first trimester. Some
Oh,
won't.
that tastes nasty.
Yeah, it
Yeah.
tastes salty. So because estrogen, there's 3 times where you get more sodium in your milk, and it is when you have mastitis or inflammation, when you have in preterm milk, and the third one is when you've got more estrogen. So prior to your period, if you've noticed that they're like, I'm not interested in the milk, and they don't want to feed as much, it's because it goes salty. And maybe maybe I'm using too much of a colloquial term there, but so in pregnancy, a lot of babies will actually just, they won't take it when you're pregnant in that first trimester, which is also why we don't want people, if it happens, that's great, but we don't want people rushing to wean their baby to do the next thing. Yeah, and we can go into all of these
All
things.
that stuff.
You just spoke, I think I saw last night or yesterday, saw your topic about under 2.
Yeah.
You did that, that was good.
Yeah.
That
But I'm not sure if it was clear though that I wasn't saying that it's problem. Like I'm saying, don't alter what your body's doing to achieve a goal. Let your body be
Yeah,
and do
understood.
what's natural for your body.
Yeah.
But I don't know if people, it's such an emotive topic.
Yeah, it's this pressure. Like, what's the rush to have 2 under 2? Like, what, give your time, your body a chance to heal and recover. And
And
but
I'm just talking about the
like your man's
risks.
experience, everyone having their 2 cents in your life. It's really hard because you're trusting them to also be like, oh, well, you have experience in this area and you're telling me to do this. There must be some wisdom behind it. And so it throws you off your own gut instincts. And then, yeah, you might end up regretting it later.
But that's what's really important, to trust your instincts though. That's why I really encourage mums to really work out what is your instinct and then listen, because the people around you are always going to protect you rather than the whole situation. Even I found with my sister, and of course I love my niece and whatever else, but I'm still trying to, you can't help it. Your first thought is to protect the mother, which I'm so surprised at. I always thought we'd all be protecting the babies, right? But actually where our instinct is, I can't tell you how many patients I say, I will be the one me and your partner are the ones that are going to disempower you. And there are many where I'm like, I really don't want you to feel pressured. It's totally fine if you do this. And they're like, no, I want to breastfeed, or I want to make more breast milk. And I'm like, are you sure? So it's the people around you that will derail you. But I can't remember, did we get off topic there?
I don't know.
No, it feels right. It feels right.
It always feels right with you.
We're almost at the end. We do have 2 last questions. Somebody asked, this was actually on my Instagram Q&A, if HG can affect breastfeeding. So this person had HG during 2 pregnancies and she lost a lot of weight postpartum.
Yeah. So she's saying breastfeeding after she has the babies?
Yeah, so she's saying, can HG affect breastfeeding?
Yeah. That's a complex one. I don't know the data on that, but we think that HG has some hyperemesis gravidarum has something to do with the placenta and what the placenta is producing. Now, we also know that the placenta is the source of the estrogen, the progesterone, the human placental lactogen, which all go to prime the breast, which was also why in answer to why breast milk tastes saltier when you're pregnant, it's because your placenta is producing these hormones, so your breasts get that as well. So that could be, I could see how it could affect it. I don't know of any association with it, but you should be able to still breastfeed completely normally, but just in contact with your doctor, because actually the real thing that happens with HG is we don't talk enough about how it affects the mental health. It is a soul-destroying thing,
I'll do last question while Miriam's emptying her bladder. Oh, hello. I'm sitting on the fun chair for once, not that shit fun chair. You can leave that in the podcast. So we do have our...
I love the sign, by the way. It's so cool.
It is cool how Miriam did this. She fixed up our whole setup. It's more exciting. So our final question. Now, I'm really curious about this one, mainly because I get asked about it a lot. And also we went through our own journey with this with Ileana when she was first born. So there's a lot of talk about tongue, cheek, lip ties, just ties in general, their relationship to breastfeeding. Now, just in the scope of today's podcast, I don't think we're going to have a lot of time to talk about, ties and relationship to long-term health or other aspects of health. But I'd love to know specifically their relevance to breastfeeding, because this is something that a lot of parents are concerned about. And there's a lot of conflicting information online, and from consultant to consultant, like lactation consultants, you're going to get different advice, different opinions. There's not really, I find, like a universal sort of professional view from what I've seen about like on social media from lactation consultants that I've met with. So I'm really curious as to what you think. Is there a bit of overdiagnosis? Is there overtreatment? What are your thoughts on ties?
Okay, great question. Okay, so I'm going to first say that I wouldn't be, even if we had time, I wouldn't be able to give you information on what happens
Yes.
later because I'm not an expert in that. But
Yeah.
we are a little bit expert in the realm of tongue ties in relation to breastfeeding. So firstly, yes, way overdiagnosed. It is the go-to for lots of people when we haven't fixed the latch. And let's first go into what I can bust categorically. Cheek ties and lip ties do not need to be revised. It doesn't even make any physiological sense, and it drives me nuts. And anybody doing it, I don't believe anybody is doing anything to babies and mothers out of bad will. I think they do it because they want to try and help, but the evidence is not there. And actually, we have a consensus statement from the American Academy of Otolaryngology, Head and Neck Surgery, which is the ENTs, the AAP, which is the Academy of Pediatricians, and the ABM. And all three had consensus that there is no such thing as a cheek tie or a lip tie that is going to affect your latch. So
Right.
absolutely should not be done. Yeah, I can't be clearer about that.
Yeah.
But the main reason we get a difference of opinion is because, again, we haven't got the knowledge out there. So the intraoral vacuum, which I've been harping on about for 2 years, is what's essential for breastfeeding, and
Yes.
the tongue function in that is really what people are getting confused about. Do you have something with a straw there that you can drink?
Miriam, can you bring me a straw?
Yeah.
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 And people can try this at home. You will understand the function of the tongue when you use a straw and drink things.
Just a straw? Yeah, I mean, there's no water in this. So I'm not going to be doing a lot.
She has a water thing. Just put some water in it.
Chuck some water in it. Thank you very much.
Yeah, thank you.
I want to record this experiment.
Yeah.
Yeah, I'm curious about this personally as well, because I saw a lactation consultant when Ileana was just born, and she was diagnosed with a tongue tie, and we basically had that revised. And I'm very curious about whether that was the right thing to do. And obviously, that was a long time ago now, where breastfeeding and life's all
Yeah.
good. But yes, super curious about it.
I get a lot of questions about that. So the first thing I want to say is if you had it done, please don't worry or feel bad about it. Okay.
Yeah.
That's the first thing. It's just, I think people are so traumatized by the experience at the time and looking for solutions and thinking that this is what it was, that's where the problem comes from. So, and also I can say that as a doctor, sometimes we have to do things which are harsh to babies, and I don't like to do them, obviously, but they are hard. So I would never have a problem with doing something. But again, like we keep saying throughout this whole time that we've talked, I have no problem doing something if it is clinically indicated, if it is necessary. I have a massive problem with doing things or taking medications or telling people it's something when it's not correct or when we haven't got evidence for it. So, so people shouldn't feel guilty. Nobody's trying to hurt people, but they need to get better information. There's also one thing which I've hesitated from saying because I don't like to say it, but also lactation consultants, according to the IBCLC code, they are not allowed to diagnose tongue ties. So this is a huge thing that is not really talked about. I actually didn't know. It was one of my friends who's an IBCLC, who's a midwife, and she's really she's on the ball. She's like amazing. She's like, yeah, no, we're not supposed to. And I was like, no, is that true? And I went and looked it up, and it's actually true. So in the IBCLC code, you can assess function and feeding, but they're not. And the reason that they say that, and this is what the ENT Academy says as well, that you need to be able to understand the complete function of the baby. You need to be able to assess for the tone of the baby's mouth. There are some conditions where you have different neuromuscular tone. And if you go and cut a tongue tie when we've got issues with, tone in a baby, what if that tongue flops back? What if there's all sorts of things affecting the airway? There's serious risks to it. So it needs to be done by somebody who is is the appropriate person to diagnose it. And that's really hard for me to say because I don't want to undermine anybody. But for me, I actually used to do them when I was at the at Prince of Wales in what do you call it? In when I was doing peds, and you have a hospital there as a backup and all of that kind of stuff. But I think you need to have the right environment, you need to have the right management, and there are complications to it. It's from the Nikki Mills, Dr. Nikki Mills in New Zealand. She did this study, I think as well with Donna Geddes, and they were looking at the what's actually in the anatomy of what's in this tissue. So if it's a simple one, it's just the mucosa. If it's, but what they found in that study is they found that it can actually contain some parts of the genioglossus muscle, right? So it's these babies that you can cut it, there's a risk of huge complications. I've seen many babies who've had it revised and they still have an oral aversion. They still have issues with it. And that's actually the issue for me. It's like I end up with the patients that have had all the revisions and then they're still having nipple pain. And even I think I did a poll on my Instagram and I was amazed by the response. I think it was 2,000 people responded and 60 something, above 60% of them had revisions that hadn't worked. And if it works, you should see an improvement in the latch within 24 to 48 hours because it's a restriction. It's not actually the whole oral function isn't the problem, you know. And you will see people saying, no, it can take a little bit of time because they have to learn to use their mouth and all that. There's just no evidence to support that. Yeah. Yeah.
So interesting.
So tongue ties.
You did.
You
got a snip.
But not cut, it was lasered.
Oh.
Yeah. So and even there that they looked at the lasers and they feel that the laser maybe has less damage for the rest of it, the rest of the surrounding tissues and things like that. But again, they still couldn't agree that it was any
Well, the interesting thing for me is it grew back because I didn't do the stretches.
No, the stretch that it grows back because it grows back. So that's the other problem we have. So
Yeah.
even there's
and then it was revised again. Like
yeah.
as in
and
like
that's
not,
so common. That's so common. And it's
then
so
interesting.
and I feel so hurt for you for so many of the things you told me just in this hour that you went through, right? Like but it's but that's why what you're doing is so important and that's why we've got to keep doing this even when we all want to get off socials because and the problem is doctors aren't on socials. I wasn't on socials. And I actually looked down on doctors on socials, you know, because I was like, no self-respecting doctor is on socials, but you know, and then I was like, but then I got frustrated because I couldn't get that information to people.
Yeah.
And so then I was like, all right, now that's it. And now late to the game as usual in medicine, we realized that we actually need to be combating all the voices out there saying that
if you're not doing it, then the counter voices are doing it and they're louder than yours. So
and they're louder and they're there in a more interesting way because let's face it, we're not the most interesting, we're dry, you know, and we can ramble on about lactocytes and, you know, microRNAs.
And look, that's no like, you know, at the time I think, you know, like I was experiencing a lot of pain and I think when you're a new parent, you just want to try everything to see if it will fix the situation. And the reality is I did still continue to experience milk blisters. I did continue to experience pain. It was to a lesser degree, but it was still there. To be honest, it wasn't until 6 weeks postpartum when my milk supply settled that everything just went away on its own.
And do you know what happens at that stage? So at 4 weeks, the baby's muscles have increased. So the baby's able to exert better pressure. So it's usually somewhere around 180 millimeters of mercury at birth. Then it can increase to 220 millimeters of mercury. So a lot of the times patients will say to me, and I never explain what's actually going on because I just don't want them to deal with the feelings. But when they're like, oh yeah, it improved at 4 months after I had it revised. And I'm like, okay, all right. But it's not the revision that caused it. It was the fact that baby developed, baby grew, baby is able to do it. And also we have developed the muscles too.
And we're always rushing to find the solution instead of just giving the time and the phases that need to be had. And we have to go through those things. And
I think when you're in pain, it's so hard as well.
When you're in pain and when you feel this pressure, like it's all on me, I'm supposed to know. And the reality is you weren't supposed to know on your own and you were supposed to be supported by people who knew. And we haven't got that system, you know, like all the people who were giving advice, even myself, the advice I was giving like 12 years ago on the postnatal wards, I didn't know what I was doing. I was doing what what I'd been taught, but it wasn't a system, right? So anyway, That's a long one. Oh my gosh, yeah, okay, we're
Can
really
can we
Definitely gotta
just
go.
wrap up that
with
section?
this tongue thing. Okay, all right. So I'm going to show
Yeah.
you the tongue function, right?
Yes.
This is all the baby's tongue really needs to do. Okay, so you've got your straw there. Lift
Yeah.
it up so we can see. Okay, so you've got some water. Okay, and if anyone's listening, let them get this too, and they can do it as well. Okay, so now take a sip of that. Yep. Okay, now stop. Okay, now I want you to take a sip, but keep your tongue on the floor of your mouth. Don't use it.
Oh shit, hold on. So that's a lot of like, all right,
So can you drink?
I didn't do that properly. Let me try again.
No, no, so keep your tongue flat.
Tongue down.
So you
So
can't
not
move
using
your
your tongue for
So
suction.
we're simulating that you're
Oh.
no, I thought like it's completely on
Okay.
the floor of your mouth. So if it's restricted, you can't move it properly.
Wait, hang on. Can you do this? Because I think I'm not doing it right.
So it's tongue at the bottom of your mouth, right?
So keep it on the bottom of your mouth
And then
and
hold it up.
like keep it keep it completely in between your teeth, you know, like this, like
Mhm.
can you see it? Like and try and drink. Try and get that liquid up. We can see we can see it going up, but you just couldn't.
It's
You
hard.
There's no suction.
you can't do it. And now what you'll notice is when you drink, you actually you use your tongue to create a little
Yeah.
Yeah.
around that.
Let me give that a go again.
It's literally just no sucking. Yeah.
Yeah.
Yeah, no, it's not coming up. It's not
But
going
yeah,
up.
so try it a few times, but when we restrict the function of your tongue, which is essentially what a tongue tie is,
Mhm.
then you can see that you can't actually move it. But what we think it is, you don't need your tongue here to drink your water.
Yeah, yeah.
You know, everyone's like, you have to be able to extend. Oh gosh, I must look crazy in these podcasts, right? But you don't need to extend it beyond the tip. It doesn't
Very
need
hard
to
to
do
get it up.
anything. All the tongue needs to do is to go up and cup the nipple. That's
Yeah.
it. That's all it does. It creates the vacuum by pushing it up.
Yeah.
And it releases the vacuum. We used to think it did all this kind of like,
Yeah. Yeah.
wave
No, it
thing.
doesn't. And you
Doesn't
see
do
you
that.
see the baby's tongue when it comes out. It's just how it just curves. So yeah.
Exactly.
Yeah.
And many of my patients, so
Oh my God.
to give you context, I have referred very, very few in the last 2 years. And I only refer it in Sydney to Dr. Dilly, who's a surgeon. That's who I
That was going to be my next question. Who actually can diagnose and who are the appropriate professionals to assess?
So yes, the appropriate professionals are breastfeeding medicine doctor, and it should be if you have a surgeon who can do it, they can do it. Some GPs offer the services, and if they've done extra training, but I'm not too sure what the extra training is other than doing it yourself. Yeah, so I've done it, but I don't offer a revision. I will send it to Dr. Dilly, who's a surgeon from the Sydney Kids Hospital.
Yeah, okay. And the stretches, is that like an evidence-based part of that? No. Okay.
Yeah. So don't think
So
that
traumatic.
nothing you did. I mean, even asking patients to do it is rude. Like again, they're already stressed out. They've gone and done this thing which they're not sure about, and then you're saying to them, now it's going to close up if you don't do this. There's no evidence for it. So that's in there. What you should read, we should put up a little picture of the ENT consensus statement. I keep going to say ENT, but it's the American Academy. They got a bunch of ENTs together and they worked out what could they say, and they couldn't agree on some things because they were like, we just don't have enough evidence for it. But there are some, it's really good to read the things that they said. Yeah.
Kavita, I'm mind blown, especially about the tongue tie stuff, because I'm surrounded by a lot of that on my Instagram. So I just feel like I've learned so much. And look, I don't think, at the end of the day, I did what I felt like I needed to do.
Exactly.
But I think that would save just so many parents from that pressure, and that, even like the stretches they felt so traumatic. Like you had to get up in the night and make sure you do them and then they even
And
suggest
shove your finger into this mouth and then like pull and push
for
and
like 10 seconds. And then even after doing it for 2 weeks, you're meant to do these like exercises like that are meant to like not traumatize them, to like make them not scared of having their fingers. And when I didn't end up doing those, but
good. Yeah.
it's just, anyway. So thank you so
More
much for
stuff to do.
But for anybody who thinks that they like, the reason they're thinking is because we need support with the latch. So we need to get better approaches with that, and that's going to happen, but it's just going to take time.
We've had such a big jam-packed session with you. We are so grateful for your time. And honestly, this episode is full of so many gems. I wish I could listen to this when I was a new first-time mum. So we can't thank you enough for all of your expertise today.
Thanks for having me.
I'm a bit obsessed, not gonna lie. I got to take you out for coffee one day when I come to
I
Sydney.
know. I was like, we're looking for the chat, but you guys we went straight into the questions. Otherwise, we never would have got anywhere. Yeah. But next time we've got to actually like meet up.
Dr. Kavita, do you work virtually at all, or do you only see patients, sort of in Sydney at a particular,
Yeah, I don't generally, and I'm also very conscious of being on socials. I don't want to promote
be
myself.
out there?
Yeah. But what I see patients in Sydney, and I see them in 2 practices. My main one at Lana Health in Randwick, but I what was the question? Oh, do I see people virtually? I don't like to see people virtually because there is so much that you have to physically see. And I also can't eyeball and see how that baby's doing. So, but on occasion, I do, if I know a lactation consultant in the place where you are, and I have a relationship with them and I can trust them. So in different cities, I will do it if I have good contacts, and I have got great contacts because of socials. I've got some great lactation consultants,
In Melbourne as well.
Oh yeah.
Yeah.
Oh,
Awesome.
you've got
If
so
we can,
like
if
Jess
we can-
Kahan in from holistic lactation. She's like phenomenal. Yeah.
If we can get you to send us at the end of this podcast, we'll pop it in the show notes. Any Melbourne-based recommendations that we can pop for listeners, and also those guidelines for the IBCLC, we'd love to read those. I think those were the 2 main, and then maybe that chart. Yeah.
The tongue thing as well. Yeah. I want to get a picture. I mean, it's a really sciencey, nerdy picture. It's just going to be like with submucosa is over here. And
maybe just for our DMs then.
Okay, yeah.
But the names that you'd recommend in Melbourne will be great, because then we can share those. I can share those with clients or people that I know.
Yeah.
As well.
Oh yeah, you've got lots in Melbourne. You've also got a lot of breastfeeding medicine doctors too.
I don't know any, so I'm happy to.
No, yeah, you've got Dr. Amber Hart, you've got Dr. Nicole Gale, and I'm going to forget some people.
Let's write this down.
Melbourne. I don't
Amber Hart, Nicole Gale. Those are the 2 I called.
Yeah, and anyone in South Australia, I think you've got Bryony, but I can't remember her last name.
Gale, how do you spell that? I-L or L-E?
Which one?
Nicole Gale.
Nicole, Gale.
Beautiful.
She has a center. What's the name of the center? A Juno specialist, I think.
Oh my God. I know Juno specialist.
Juno, yeah.
Oh, amazing.
And, yeah, Juno, and she's a breastfeeding medicine doctor. And she also does a lot of stuff with ADHD people too. So
amazing. Perfect. Thank you so much, Kavita. We absolutely love you. Have an incredible rest of the day. And for all of our listeners, please enjoy and like, share, subscribe, leave us your feedback. And we can't wait to bring you more evidence-based content.
Okay. Thank you so much for having me. Yeah, you guys are amazing. I love chatting to you guys.
I appreciate you so much. Honestly, so much.